And we really do thank the panel. That was a terrific session. And we have one more session, and it's for tonight. And it's a very important one because you're going to be addressing populations that, frankly, don't get talked about as integrated into our full healthcare system. So this is a rather critical session and a good way to conclude today. And of course, we'll take up additional topics tomorrow. So I'm going to turn this over to my colleague and our host at Georgetown, Studies-Kupersmith.
Hi. Thank you very much, and I will also welcome you to Georgetown, as Dr. Hilton did this morning. I want to just start by commenting on the last panel, and I was delighted to hear the word professionalism a number of times. I don't know that I heard it earlier today, and after all, that's where our profession started, with Hippocrates, and that was the whole point of the Hippocratic Oath. And I do think if we lose that, amidst all the statistics and data and evidence-based care and all of that, it's a big loss. And it has to be factored in to workarounds in everything we do. In fact, workarounds kind of eat into professionalism. It's one of the problems. So the next thing I want to say, it's been a long day. You probably need a pickup. You are probably tired, and you probably think you've heard everything about this topic. So I will mention something that's been mentioned before, the Lake Wobegon standard, where all our panels in the symposium are above average. But this one is particularly above average. And I have spent time on the telephone with each of these panel members, and I can assure you they know everything. So you should stay for the Q&A as well as the discussion. Now, underserved health care is a very important part of our health care delivery system. And just one data point, 57 million people live in 5,864 designated primary care shortage areas. There are all sorts of issues in underserved care, and workarounds and administrative burden are certainly one of them. Now, some of the issues have been discussed. The Camden experience certainly brings to light many of them, and earlier a number of other panels discussed, at least in part, underserved areas. But there are some things that are characteristic. One is there are more social issues, so there's more work to do. There tends to be less resources, so there's more work with less resources. There is both a concentration of issues and intensity of issues that is present in the rest of the healthcare system, and there are also unique features. So on this panel, we're going to discuss mental health, we're going to discuss substance abuse, and we're going to discuss a number of other aspects of workarounds in the underserved, and we'll start with Richard.